047891810788454. Join us in celebrating this milestone. International Paramedical and Nursing Schools Maya, Health Our Priority. International Paramedical and Nursing Schools, Maya, cordially invites all graduating students to the third graduation ceremony. The ceremony will take place on the 5th of April, 2024, at the school main square. We extend this invitation to all graduands, who are encouraged to bring two parents or guardians to join the celebration. Please ensure your arrival by 8:30 a.m. The graduation book will be provided to all graduands at the venue. For inquiries and additional details, feel free to contact us on 0775 534 0704789 181 0788 457 Join us in celebrating this milestone. International Paramedical and Nursing Schools Maya, Health Our Priority. International Paramedical and Nursing Schools, Maya, cordially invites all graduating students to the third graduation ceremony. The ceremony will take place on the 5th of April, 2024, at the school main square. We extend this invitation to all graduands, who are encouraged to bring two parents or guardians to join the celebration. Please ensure your arrival by 8:30 a.m. The graduation book will be provided to all graduands at the venue. For inquiries and additional details, feel free to contact us on 0775 534 797 070 4789 181 0788 457 Join us in celebrating this milestone. International Paramedical and Nursing Schools Maya, Health Our Priority. International Paramedical and Nursing Schools, Maya, cordially invites all graduating students to the third graduation ceremony. The ceremony will take place on the 5th of April, 2024, at the school main square. We extend this invitation to all graduands, who are encouraged to bring two parents or guardians to join the celebration. Please ensure your arrival by 8:30 a.m. The graduation book will be provided to all graduands at the venue. For inquiries and additional details, feel free to contact us on 0775 534 797 070 4789 181 0788 457 Join us in celebrating this milestone. International Paramedical and Nursing Schools Maya, Health Our Priority. International Paramedical and Nursing Schools, Maya, cordially invites all graduating students to the third graduation ceremony. The ceremony will take place on the 5th of April.
skills. We all know that it is a dangerous world out there and you should be well equipped with survival skills, however much you're not an emergency medical technician. So today I'll be taking you through a series of chain of survival, an adult chain of survival. And specifically we shall be looking at what they call a cardiac arrest. Okay? A cardiac arrest, or basically heart conditions, are one of the leading major causes of death currently in the world. And how would you combat a cardiac arrest? How would you buy time in case your mother, father, your relative, your friend acquires or sustains a cardiac arrest in your presence? Okay? But before I take you through a series of how you can manage a cardiac arrest in schools, homes, or wherever you will be, let me first take you briefly through a chain of survival, an adult chain of survival. An adult chain of survival, by definition, okay, or in simple terms, is a series of steps, okay, that are employed to combat a cardiac arrest. In other words, to help someone who has suffered a cardiac arrest to survive or increase chances of his survival. Okay? 1. Let me take you through the steps of an adult chain of survival. 1. It includes a recognition of a cardiac arrest, plus alerting emergency services or calling for help. That is the first step. You have to recognize a cardiac arrest first, in case you suspect a person who has sustained it. Then you have to activate help. How? You can call medical services, okay, at a nearest health center in case you can access them, like an ambulance, or any medical profession you can access, you can call for help. Then 2, you have to employ a CPR, that is cardiopulmonary resuscitation. Then 3, you have to employ early defibrillation. Then lastly, you have to employ advanced cardiac life support. Okay? I'm going to go through the 4 steps briefly. Okay? Now, someone has sustained a cardiac arrest. This cardiac arrest is a sudden cessation of the heart activity. Our heart has stopped, okay, from pumping blood to the body. Okay, so what do you do? 1, in an adult chain of survival, I've said you have to recognize a cardiac arrest. Okay, and how do you recognize a cardiac arrest? 1, there is a history of the signs and symptoms of a cardiac arrest, which is always sudden collapse, there is loss of consciousness, easy fatigability, and chest pain. And this history can be ascertained from either the bystanders, who might be relatives or friends who are around when this person sustained cardiac arrest. Then 3, you have to run an emergency assessment on these casualties who have suffered a cardiac arrest. How do you perform this emergency assessment? 1, you have to check for levels of response if they are really alert. 2, you have to check their airways if they are really open. Then 3, you have to check if they are breathing. Okay? How do you check for breathing? You have to look at the chest movements if this person is moving. Of course, if a person is breathing, we always have the chest contracting and recoiling. Okay? Then you have to also feel for air moving out of the nostrils. Okay? Then lastly, you have to check for saturation. How do you check for saturation? You have to check for the heartbeat if it is present. 2, you have to check for pulse if it is present. But in most cases, our casualties who suffer cardiac arrest are usually unconscious, have no heartbeat, and there is no detectable pulse. After recognizing the cardiac arrest, you now have to call for help from any emergency medical team that you can access. Then step 2 in a chain of survival is employing a cardiopulmonary resuscitation. Cardiopulmonary resuscitation, these are steps employed that include cardiac massages and artificial respiration in order to resuscitate or bring back to life the heart function and the respiratory system back to life. Then step 3, in case CPR fails, you can employ defibrillation. Defibrillators are basically medical equipments or apparatuses that usually trigger or wake up the heart activity by employing or by passing an electric current through the heart and the chest. Then lastly, for these people to really survive or increase their chances of survival, you have to hand over these casualties to paramedics or medical professionals who are experienced in advanced cardiac life support, which will be later given in the hospital during their secondary and tertiary management of their cardiac life. Okay? So, what are the complications of a cardiac arrest? In case you don't employ the adult chain of survival, the steps I've mentioned. 1, we shall have clinical death. Clinical death is whereby the cardiovascular system basically collapses and there is insufficient supply of blood to vital centers and other body tissues. Between 30 to 2 hours, we shall have our brain cells dying off. And once our brain cells start to die off, okay, or if you have multiple organ failure, this is where biological death will come in, and this is where someone will be declared dead. Okay? So you don't wish your friend, your colleague, your relative, mother or father to suffer a cardiac arrest and have what they call a clinical death or a biological death. Okay? So let me take you through the steps basically of how to employ cardiopulmonary resuscitation in the adult chain of survival. Here is our casualty. We expect to have suffered a cardiac arrest, and we are going to employ cardiopulmonary resuscitation in respect to the adult chain of survival. Okay? So 1, we said you have to recognize the cardiac arrest. So we are going to check for levels of response. How do you check for levels of response in casualties? Okay. We are going to tap the casualty or call him by name in case you have taken history and you have gathered enough demographic data on the casualty. So, hello sir, hello. So you tap the shoulder, okay, to check if the casualty can respond. Okay. You try to pinch the earlobe to check if the casualty can respond. So in this case, our casualty is not responding. So the casualty is unconscious. So we are going to also check for the airways if they are open. So how do you check for the airways? You tilt the head a bit backwards. Okay. So you have to inspect the nostrils if there is no obstruction. Inspect the mouth if there is no obstruction or the tongue is not obstructing. Okay, the throat or the airways. In most cases, sometimes the tongue can fall back and block the airways. Then you have to also feel for the air moving out of the nostrils. You have to feel for that air moving out of the nostrils for 10 seconds. So in this case, there is no detectable air flowing out of the nostrils. Then you have to observe the chest rising and falling. So in this case, breathing is compromised. Then you have to check for saturation. That is blood saturation. You have to ascertain if our casualty is having blood flowing to other body tissues and organs. So how do you check for pulse? We have different sites for taking pulse. But for now, I'm going to use the carotid artery. So you come and feel for the carotid artery, okay, just opposite the hyoid bone, and you feel for the pulse. In this case, there is no pulse. Then you have to check the heartbeat. Okay? So how do you feel for the heartbeat? Okay? You have to bring your ear closer to the left side of the chest, okay, and feel for the heartbeat. So in this case, there is no detectable heartbeat. In case you have a stethoscope, you can use it to feel for a heartbeat. You can feel for the heartbeat. So in this case, our casualty is under what they call clinical death due to a cardiac arrest, and we have now to buy time, okay, for this casualty to survive. So we are going to perform cardiopulmonary resuscitation. Make sure that your protective gears are on, basically the gloves, okay. Then make sure you have a CPR face mask that we shall use for giving the artificial respiration, that is mouth to mouth. Okay. Now, we are going to start with what they call the chest compressions or cardiac massages. So, we are going to give a series or a cycle of 30 chest compressions and 2 rescue breaths. The chest compressions. So, kneel with your legs apart, okay, on the left side of the casualty. Okay. Get your recessive hand. For this case, my left is the recessive hand or the weaker hand. Okay. Then position the heel of the weak hand in the middle of the chest, specifically on the breastbone or the medial sternum. Okay. At the midline of the nipples, you have to locate the nipples. Okay. Then in the midline of the nipples, okay, it is where you're going to place the heel of your weak palm on the sternum. Then you're going to interlock, okay, the fingers of the weak hand with the fingers of the dominant hand, okay. And then we are going to start giving our cardiac massages or chest compressions, which are 30 at a rate of 100, okay. 100 compressions per minute. Okay. So make sure your elbows are straightened up and then give the cardiac massages as fast as possible at a rate of 100 to 120 compressions per minute. 1, 2, 3, 4, 5, 6, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30. Okay, so you give 30 chest compressions at a rate of 100 to 120 compressions per minute at a depth of about 2 inches. So you should really compress the chest to a depth of 2 inches. I guess that really hurts, but you have nothing to do. We have to really save this casualty. Of course, you might have some ribs breaking, but surely it is rather you break a rib and someone survives rather than burying someone because of a cardiac arrest. So after giving the 30 chest compressions, you have now to give the rescue breaths. Those are 2. So you have to get your CPR face mask. Insert it into the casualty's mouth. Take in 1 deep breath, do not release it. Okay. Tilt the casualty's head backwards without releasing the breath. Okay. Seal up your lips onto the CPR face mask and blow in air into the casualty's mouth and observe the chest rising. Taking in another deep breath, do the same, tilt the head, blow in air into the casualty's mouth and observe the chest rising. Okay. After giving the rescue breath, check for the pulse, check for the heartbeat, and again check for breathing. Okay. And that is how we give CPR to buy time or to increase chances of survival of someone who has suffered a cardiac arrest. Okay. So you will continue giving CPR until the emergency medical services you called arrive. And in case you're tired, of course it is tiresome, you can give in to the bystander to continue giving CPR. Okay. So that is our CPR and adult chain of survival. Okay. In case you cannot perform CPR, or in case CPR fails, This is where you employ a defibrillator. Thanks for watching. I remain Governor Derek, your today's emergency medical technician. Continue following, liking, okay, and don't forget to hit the bell, okay, for more notifications, okay, and keep tuned for more survival skills. Okay, stay safe. It is a dangerous world out there.
Eight for 57434. Join us in celebrating this milestone. International Paramedical and Nursing Schools Maya, Health Our Priority. International Paramedical and Nursing Schools, Maya, cordially invites all graduating students to the third graduation ceremony. The ceremony will take place on the 5th of April, 2024, at the school main square. We extend this invitation to all graduands, who are encouraged to bring 2 parents or guardians to join the celebration. Please ensure your...
Hello everyone, I'm Advert, a student midwife from International Paramedical and Nursing Schools Maya. I'm here to perform baby weighing. Clean trolley for baby weighing and contains the following requirements. I have a gauze pod containing cotton swabs, which I'm going to use for cleaning the weighing pan. I have another gauze pod containing antiseptic for cleaning the weighing pan. Here is the receiver to receive used swabs. I have here clean gloves to prevent cross-infections. Then the weighing pan for weighing our baby. I have a pen and a growth monitoring chart for easy monitoring the growth of our baby. I have here a cloth which I'm going to spread on the weighing pan.